18 Symptoms and signs of cancer. Cancer is caused by changes, mutations, to the DNA within cells. The DNA inside a cell is packaged into a large number of individual genes, each of which contains a set of instructions telling the cell what functions to perform, as well as how to grow and divide. Errors in the instructions can cause the cell to stop its normal function and may allow a cell to become cancerous. Cancer refers to any one of a large number of diseases characterized by the development of abnormal cells that divide uncontrollably and have the ability to infiltrate and destroy normal body tissue. Cancer often has the ability to spread throughout your body. It is the second leading cause of death in the world. But survival rates are improving for many types of cancer, thanks to improvements in cancer screening and cancer treatment. Cancer often has no specific symptoms, so it is important that people limit their risk factors and undergo appropriate cancer screening. Most cancer screening is specific to certain age groups, and your primary care doctor will know what screening to perform depending on your age. Consequently, individuals need to know which symptoms might point to cancer. People should not ignore a warning symptom that might lead to early diagnosis and possibly to a cure. If certain symptoms occur or persist, however, a doctor should be seen for further evaluation. Some common symptoms that may occur with cancer are as follows. Persistent cough or blood-tinged saliva. These symptoms usually represent simple infections such as bronchitis or sinusitis. Coughs are common with colds and some other health conditions. But if an unexplained cough doesn't go away in a few weeks or gets worse, it could be a sign of cancer. They could be symptoms of lung cancer or head and neck cancer. Anyone with a nagging cough that lasts more than a month or with blood in the mucus that is coughed up should see a doctor. A change in bowel habits. Most changes in bowel habits are related to your diet and fluid intake. Doctors sometimes see pencil-thin stools with colon cancer. Occasionally, cancer exhibits continuous diarrhea. Some people with cancer feel as if they need to have a bowel movement and still feel that way after they have had a bowel movement. If any of these abnormal bowel complaints last more than a few days, they require evaluation. Any significant change in bowel habits that cannot be easily explained by dietary changes could be cancer-related and needs to be evaluated. Have problems peeing, or if there's blood in your pee or poo. A change in bowel habits can include constipation, looser poo or pooing more often. Problems peeing might be needing to go more often or urgently, experiencing pain when peeing, or not being able to go when you need to. These symptoms can all be caused by conditions other than cancer, but it's best to get them checked out. Blood in the stool. A doctor should always investigate blood in your stool. Hemorrhoids frequently cause rectal bleeding, but because hemorrhoids are so common, they may exist with cancer. Therefore, even when you have hemorrhoids, you should have a doctor examine your entire intestinal tract when you have blood in your bowel movements. With some individuals, X-ray studies may be enough to clarify a diagnosis. It also includes any unexplained vaginal bleeding between periods, after sex or after the menopause. Colonoscopy is usually recommended. Routine colonoscopy, even without symptoms, is recommended once you are 50 years old. Sometimes when the source of bleeding is entirely clear, for example, recurrent ulcers, these studies may not be needed. Unexplained anemia or low blood count. Anemia is a condition in which people have fewer than the expected number of red blood cells in their blood. Anemia should always be investigated. There are many kinds of anemia, but blood loss almost always causes iron deficiency anemia. Unless there is an obvious source of ongoing blood loss, this anemia needs to be explained. Many cancers can cause anemia, but bowel cancers most commonly cause iron deficiency anemia. Evaluation should include endoscopy or X-ray studies of your upper and lower intestinal tracts. Breast lump or breast discharge. Most breast lumps are non-cancerous tumors such as fibroadenomas or cysts. But all breast lumps need to be thoroughly investigated for the possibility of breast cancer. A negative mammogram result is not usually sufficient to evaluate a breast lump. Your doctor needs to determine the appropriate X-ray study, which might include an MRI or an ultrasound of the breast. Lumps are not the only breast changes to tell the doctor about. Also look out for any change in the size, shape or feel of a breast, or any skin changes, redness, or pain in the breast. And don't forget any nipple changes, including fluid, which could be blood-stained, leaking from the nipple if you're not pregnant or breastfeeding. Breast cancer is most common in women. But whatever your gender, it's important to tell your doctor about any unusual breast changes. Generally, diagnosis requires a needle aspiration or biopsy, a small tissue sample. Discharge from a breast is common, but some forms of discharge may be signs of cancer. If discharge is bloody or from only one nipple, further evaluation is recommended. Women are advised to conduct monthly breast self-examinations. Lumps in the testicles. Most men, 90%, with cancer of the testicle have a painless or uncomfortable lump on a testicle. Some men have an enlarged testicle. Other conditions, such as infections and swollen veins, can also cause changes in your testicles, but any lump should be evaluated. Men are advised to conduct monthly testicular self-examinations. A change in urination. Urinary symptoms can include frequent urination, small amounts of urine, and slow urine flow or a general change in bladder function. These symptoms can be caused by urinary infections, usually in women, or, in men, by an enlarged prostate gland. Most men will suffer from harmless prostate enlargement as they age and will often have these urinary symptoms. These symptoms may also signal prostate cancer. Men experiencing urinary symptoms need further investigation, possibly including blood tests and a digital rectal exam. The PSA blood test, its indications, and interpretation of results should be discussed with your healthcare provider. If cancer is suspected, a biopsy of the prostate may be needed. Cancer of the bladder and pelvic tumors can also cause irritation of the bladder and urinary frequency. Blood in the urine, hematuria or blood in the urine can be caused by urinary infection, kidney stones, or other causes. The blood could be visible by the naked eye or might be found on a urine examination, microscopic hematuria. For some people, it is a symptom of cancer of the bladder or kidney. Any episode of blood in the urine should be investigated. Hoarseness, not caused by a respiratory infection or that lasts longer than 3 to 4 weeks, should be evaluated. Hoarseness can be caused by simple allergy or by vocal cord polyps, but it could also be the first sign of cancer of the throat. Persistent lumps or swollen glands. Lumps most frequently represent harmless conditions such as a benign cyst. A doctor should examine any new lump or a lump that won't go away. Lumps may represent cancer or a swollen lymph gland related to cancer. Lymph nodes swell from infection and other causes and may take weeks to shrink again. A lump or gland that remains swollen for 3 to 4 weeks should be evaluated. Obvious change in a wart or a mole. Multicolored moles that have irregular edges or bleed may be cancerous. Larger moles are more worrisome and need to be evaluated, especially if they seem to be enlarging. Removing a mole is usually simple. You should have your doctor evaluate any suspicious mole for removal. The doctor will send it for examination under a microscope for skin cancer. Indigestion or difficulty swallowing. Most people with chronic heartburn usually do not have serious problems. People who suffer from chronic or lasting symptoms despite using over-the-counter antacids may need to have an upper GI endoscopy. A condition called Barrett esophagus, which can lead to cancer of the esophagus, can be treated with medication and then monitored by a doctor. Difficulty swallowing is a common problem, especially in elderly people, and has many causes. Swallowing problems need to be investigated, because nutrition is always important. Difficulty swallowing solids can be seen with cancer of the esophagus. Unusual vaginal bleeding or discharge, or bloody discharge may be an early sign of cancer of the uterus. Women should be evaluated when they have bleeding after intercourse or bleeding between periods. Bleeding that comes back, that lasts 2 or more days longer than expected, or that is heavier than usual also merits medical examination. Postmenopausal bleeding, unless expected on hormone therapy, is also worrisome and should be evaluated. Usually, the evaluation will include an endometrial biopsy, in which a doctor takes a small tissue sample from inside the uterus for testing. A pap smear should be part of every woman's routine medical care. Unexpected weight loss, night sweats, or fever. These nonspecific symptoms might be present with several different types of cancer. Pancreatic cancer can appear with weight loss and no specific pain. Various infections can lead to similar symptoms, for example, tuberculosis. Continued itching in the anal or genital area. Precancerous or cancerous conditions of the skin of the genital or anal areas can cause persistent itching. Some cancers cause skin color changes. Several infections or skin conditions, for example, fungal infections or psoriasis, also can cause these symptoms. If itching does not stop with over-the-counter topical medications, your doctor should inspect the area. Non-healing sores. Sores generally heal quickly. If an area fails to heal, you may have cancer and should see a doctor. Non-healing sores in your mouth or persistent white or red patches on your gums, tongue, or tonsils also should raise concerns. Some non-healing sores may be due to poor circulation, for example, diabetic foot ulcers. Headaches. Headaches have many causes, for example, migraines, aneurysms, but cancer is not a common one. A severe unrelenting headache that feels different from usual can be a sign of cancer, but aneurysms may present in the same way. If your headache fails to improve with over-the-counter medications, see a doctor promptly. Back pain, pelvic pain, bloating, or indigestion. These are common symptoms of daily life, often related to food intake, muscle spasms or strains, but they also can be seen in ovarian cancer. Ovarian cancer is particularly difficult to treat, because it is frequently diagnosed late in the course of the disease. Pain is one way our bodies tell us that something is wrong. As we get older, it's more common to experience aches and pains. But unexplained pain could be a sign of something more serious. Until a cure can be found, prevention through a healthy lifestyle is the best way to stop cancer. Some ways to help protect yourself from cancer include eating plenty of fruits and vegetables, maintaining a healthy weight, abstaining from tobacco, drinking only in moderation, exercising, avoiding sun damage, getting immunizations, and getting regular health screenings.